Well, I'm here with Dr. Toby Cosgrove, who is the CEO, and it seems like you're the founder of the Cleveland Clinic.
Well, I've been here that long.
No, it just seems like it's having a renaissance since you took the helm. And there's so much exciting stuff. You're partnering with the Case Western Medical Reserve on a very cool new technology, which we're going to talk about today, the HoloLens. Tell me a little bit about that.
Well, it's terrific. It's augmented reality, and I initially saw it now almost 3 years ago when Microsoft was working on it, and it hadn't really gotten to commercial product yet. And we saw the potential of it for education.
But you were looking at a Mars rover, right? I mean, you weren't actually thinking about anatomy at the time.
No, actually, we weren't thinking about anatomy. They put us in a room, and they had a relationship with the Jet Propulsion Laboratory. And the Jet Propulsion Laboratory has got a rover on Mars, and I put the goggles on, and I'm on Mars. It's amazing. And so they use this to decide where they're going to drive the rover every day. And we said, oh my goodness, this is a game changer. And can you imagine all the things that you have to learn and being able to visually see them at the same time and immerse yourself into them? It was really stunning.
So augmented reality, so you're in a real world setting, but then there's a sort of a superimposition of another world, right?
Exactly what it is. I mean, for example, you see a hologram, you can walk around the hologram, it's in your room.
It's incredible. And so you imagine what it would be like for anatomy and creating this sort of virtual anatomy idea. And you talked to your colleague, Dr. Mark Griswold, and you said, get on a plane, right?
Yeah, we saw this, and I was out there with President Snyder, and the two of us talked about it, and we saw the potential of it, and we just said, Mark, get out there, and we sent him out the next week, and he got involved, and you'll see the fruits of his labor, which are really quite stunning.
And so when you're a medical student, now you and I talked about this, you're of course a famous heart surgeon.
Used to be. But you've invented different procedures, and you said to me, if I had had this when I was a medical student, I would have been a better surgeon. So you were one of the best in the world. Well, we started out when I was in medical school with a cold cadaver.
Right.
And I remember the first...
Are there warm cadavers, by the way?
No, they're not warm cadavers.
Just checking, because I'd be worried about that. Okay.
But we spent the first, I think, 10 days just dissecting the nerves to the skin in the arm. I mean, what an incredible waste of time. I never even thought about it subsequently. But we couldn't see the big picture of things. You couldn't walk around and look at them from different directions. They were just, there they were. And it was, then when I got to be a heart surgeon, I had to learn the anatomy of the heart all over again.
Learn it by actually seeing it as you were taking apart hearts and cutting and pasting.
Well, some of that, but also books and Frank Netter's drawings of the heart, and multiple publications and different things, and people studied different parts of the heart. I even went back to Leonardo da Vinci's works, drawings of the heart, which were really incredibly.
Let me do
Anatomias?
What's the man's called?
And so, but his drawings, by the way, are spectacular.
Right.
And very accurate and very interesting. So I went back, and so I just pieced it all together, a piece at a time, but you never got sort of a three-dimensional view of it. Mm-hmm. You never could look at it from over here and over here. You looked straight at a drawing. And now you now have the ability to understand the body as you walk around it, and you see where things fit into the program a bit at a time.
So you see the context of the body, and you actually see the relative sizes and proportions of things and the way they shape, and being able to see how those shapes bend as you move around.
Exactly. So it's a much more dynamic understanding of what's going on, and you could put it in context of the whole body, not just some little thing that you're studying at that particular time. It's actually fascinating, and I think it will give people greater understanding, and I think what the next step is, it's going to clearly move into the clinical arena. Right. I mean, where guys are already starting to use it and say, now how can we use this so we start to think about face transplants?
Right.
and what will this mean is how we reconstruct the face. So, I think that's just the beginning of our understanding of the uses of this sort of technology.
So when we talk about what you can see in this virtual anatomy, you can see these schematics not just of bones and ligaments and tissue, but you can actually see, say, the white matter in the brain coming through different pathways.
Oh,
nerves, right?
Yeah, I mean, that's astounding,
Yeah.
to see the various pathways in the brain. Very hard to understand. Certainly can't see them as you look at them.
Right. You certainly can't understand my pathways. I know that. Those are challenging.
No, but you can't see them in a dissection.
Right.
And you're taking the material from a functional MRI and beginning to look at these pathways in the brain. And so you can walk around them and look at them from different directions and understand them in a way that you never could before.
Now, we're at the point right now where we're seeing these schematics essentially, and very well informed, you know, based on real life human biology. But we are not at the point of understanding the pathology yet. So where we have an individual's disease. So you're a heart surgeon. It'd be great if one day you could see, say, a patient's, you know, faulty valve that was particularly tricky, and be able to upload that through, say, a CT scan or other imaging, and then see that in the HoloLens.
I think absolutely we'll be able to do that. I don't have any question about that. And that will add the next dimension of how we use this and clinical understanding.
What about at the cellular level? You know, coming down, right now we can see tissues and we can see linings of organs, but could we actually see the cells?
You know, I think I'm frankly not sure whether we are going to be able to do that or not. I'm sure that with the proper microscopic pictures, you can load those in and figure out how you do it. But I mean, you should stop and think, you can look at the pharmaceuticals, the structure of a drug. Mm-hmm. You can see it out in the middle of the air. You can walk around it and see the various covalent bonds that it has. It's pretty exciting stuff. And I think it's just going to add another dimension to how we begin to understand the anatomic and the medical world.
And when students are going into these HoloLens, you see their hands moving. They're actually moving the parts around, and they're looking. You know, it's a kind of a hands-on learning, and it changes the way they learn, right?
Well, I think it's going to change the way they learn, and it's part of the bigger picture of what we're trying to do with this building we're building across the way.
Oh yeah, yeah. Tell me about that. Yeah.
So what this building is quite unique. It's bringing medical students, dental students, nurses, physicians, assistants, all in one building to begin to talk about teamwork, because healthcare has gotten so big and so complicated that the guy with the black bag who used to come to your house,
I like that guy.
We all like that guy, but he can't manage it all anymore. He can't have all the cures and all the diagnosis and all the knowledge in that black bag. So it takes a whole team of people. And so what we're trying to do is teach teamwork now from the get-go, and then to begin to incorporate the technology that is now becoming available to us in a different sort of a way. Watson, for example, is going to move into there, and Watson has been going to medical school here for the last 3 years, and Watson has learned now to read the history, the physical, and the lab studies, and give you a problem list as well as the doctor can do. Pretty exciting stuff.
How good a student is Watson?
Watson's a very good student. Not very much fun on Saturday night, though. Not much personality.
Down at the Rathskeller, not
no.
Yeah.
But Watson is able to read 40 million documents in 15 seconds and remember it all. Now, you stop and think about what's going on now with the explosion in knowledge. The total amount of knowledge in healthcare is now doubling every 73 days. There are 5,600 journals, and there are turning out 900,000 journal articles a year. Nobody can keep up with all that. Yeah. And then you look at the place of the human genome coming along, so which has got 3 billion data points in every human genome. So the amount of data you've got to handle is just enormous. So Watson's going to come in, HoloLens is going to come in. We're looking at MOOCs to begin to help teach. We want to take the technology that's now available and bring it to bear in education in a new way, teaching teams how to work together.
And you're teaching not just with technology, but changing the human behavior, because you're noticing the way that people interact in a different way and how they internalize knowledge after being in something like the HoloLens or being exposed to these interdisciplinary teams.
Absolutely. This is about teams, and this is about how people interact both with each other and with the patient.
Yeah.
Which is going to change how physicians think about interacting in the greater universe of people.
Yeah. Do you remember the first time where you actually looked at the anatomy on the HoloLens? What your reaction was?
I went, oh my God, I can't believe this. Just recently, I have the HoloLens on, and I'm walking around a body that's floating out here in space, and they say, Toby, stick your head in.
Yeah.
And so I go like this, stick my head in, and my head's in the chest cavity, and I'm looking down on the diaphragm.
Oh my God.
Now, that's the first time I've ever looked down on the diaphragm, because as a chest surgeon, you can't see the diaphragm all in one slug because there's this funny thing called lungs that get in the way.
Yeah.
And so this was an opportunity for me to understand this portion of the anatomy in a different way than I'd ever seen it before in 40 years as a chest surgeon.
That's incredible. Now, as somebody who understands the heart probably better than 99.9% of the people on the planet or more, what did you learn about the heart? Anything from looking at this?
Well, you could see the interaction, for example, you could see the interaction of the muscles that support the mitral valve and how the valve opens and closes.
Yeah.
And you could understand that. I mean, it took me forever to understand that as a doctor but all of a sudden you can see it actually happening. And you say, oh, I understand that. Now these little muscles contract and the valve opens.
And when they don't open, you get the prolapse, or you get this, and you can see how that
Wait a minute, have
happens.
you had some medical training?
I've been listening to you for a while, yeah. So you can actually start to understand where things break down a little bit better because you're seeing the actual movement, the mechanical movement in a way. Yeah. So students, have you talked to any of them about this? What their experience is?
Oh, the students really see this thing as a way to understand what's going on much better than they could just in anatomy. I mean, think about the nerves, the nervous system.
Yeah.
I mean, you dissect a cadaver.
Yeah.
You can't figure out how it goes from here to here.
Right.
There's no way you can see it. I mean, it just doesn't travel, in something that anatomically you can dissect. But you can understand it by looking at a schematic that shows it and how it happens.
Right, it's incredible. And then you can actually, as we get better at programming these, we can program in failure in the system. So we can see, for example, if you've got a severed nerve here, how it would affect your...
Oh, absolutely, absolutely. You can, I mean, it's just a matter of programming what you want to put into this.
Right.
Now that's not a simple process, but it's a big effort. But you can program all kinds of things into as a teaching aid.
If you're looking at, for example, something like, the process of cancer and understanding cell signaling, we'll be able to look at that one day.
I think I can only imagine the potential of this.
Right.
I mean, it is huge to begin to understand this. And we saw a very nice example the other day of if you put a tumor on a location in the brain, what it affects and what it will affect in the various pathways in the brain that it will affect.
Are we in a revolution? Are we in a healthcare revolution right now?
Oh, I think we are right now going through the biggest change in healthcare that's happened in a century.
Wow.
And it is, we are moving now on multiple different areas. I mean, we're changing right now from how we get paid for looking after people to how we begin to look after populations. And we're trying to keep people well and out of the hospital instead of just trying to fix them once they get in the hospital. We're changing our understanding of genomics, which is a huge issue. And the more we study, the more we understand the influence of genomics. We're understanding the influence of everything in the environment and how they affect you. Everything you put in your mouth and how it affects the rest of your body, which is the biggest environmental influence on your life. We're also have this explosion in knowledge, and with artificial intelligence begin to try and understand how we can take this knowledge and begin to look for early signaling of problems of people that we never have before. We recently put together a company called Explorus, which had collected 50 million patient records. Now you can imagine, you can go to that and say, I want to know how many people who are 43 years old who have diabetes are taking this drug, and in 2 nanoseconds you have that.
Wow.
I mean,
finding out what the potential, side effects they have, or
Exactly.
adverse effects from taking that drug, or if there's some relationship with another morbidity or disease.
Exactly, and so you start to see connections that you never could pick up just from looking at 100 patients.
So you've talked about this explosion in knowledge, the explosion in all these new technologies. How much is there also a change in mindset? And what I mean by that is there a sense of a disruptive restlessness, a sense that, we're just tired of doing things the old way, the old traditional hidebound ways, and, particularly in an industry that is pretty hidebound?
Yeah, healthcare clearly is very hidebound, and I think one of the things that is being very disruptive is all the social media that has come to affect that. And if you look at where venture capitalists are putting their money, they used to put it in devices and pharmaceuticals. Now it's going into IT. And there are more new companies being spun up that are looking at ways to take care of patients, how to facilitate care, how to change the way we understand the pathologic processes. So the whole process is changing. Right now, for example, I can get on my cell phone any place in the world and get a consult from the Cleveland Clinic and talk to them on my cell phone.
That's incredible. Yeah.
I mean, think about what that means. Think about the fact that we can do virtual medicine. I can make sure that Mrs. Jones at home I can talk to her on her Skype or on her cell phone and make sure she's taking the blue pills instead of the green ones. And so she's right. I can look after people in nursing homes without ever going to visit them. I can get a dermatologic consult from home just by holding up the cell phone to the rash and asking what it is. We're looking now we're reading x-rays from Abu Dhabi. We're looking at pathology slides from China. This is an incredible change that technology is bringing us, and with it comes the mindset of millennials who want to have instant access to care at any place, anywhere, anytime.
People feel frustrated when you say healthcare. In fact, we were thinking about what word to put on our cover, whether healthcare had such bad connotations now. But you don't sound like you're that frustrated. You sound pretty optimistic.
Well, I'm excited. I'm excited because I think we're moving from the time of sick care to the time of well care, and trying to keep people well and out of the hospital. And if you look at the financial ramifications of all this for our country, the big issue that we have is the exploding cost of health. And that's the root cause of all this discussion about what we're going to do about coverage. And but the root cause of the problem is the exploding cost, and the cost has gone up for 2 reasons. One, more older people, and secondly, more things we can do for them. Now, and this is not just the United States, this is all over the world. Everybody is concerned about this rising cost of healthcare. So what we have to do is we have to look at how we can, A, keep people well and keep them out of getting sick. I mean, just think, for example, 10% of the healthcare costs in the United States are from obesity. So keep them well, and then if they do get sick, get them into the most efficient healthcare delivery system that we can. Hopefully keep them out of the hospital. And that is a major change in our thinking.
Toby Cosgrove, it's an honor and a pleasure to talk to America's doctor.
I enjoyed it.
Always. Thank you.
You.